we could bring up the slides. This webinar is on the American Rescue Plan Act rate increases, and thank you for your patience. I know we've scheduled this a few times, and the reason why we had to reschedule is we were really waiting for CMS to signal to us the approval of our Appendix K, which is the vehicle for giving us authority to actually implement the rate increases. So again, thank you for your patience and welcome to this presentation. Next slide. So here's our agenda today. I'm going to be giving a few brief facts on what the American Rescue Plan is and how these rate increases are coming about and some context. And then we're going to go into the information about the rates and how to implement the billing. So really the billing instructions, the how to, what to do. The billing information for most services is done one way. And then number 4 here, there is a different methodology or information that goes along with billing for the ResHab services. So the difference between certified and licensed settings, and information which is a little bit different for the consumer-directed services or option. Then we're going to go into the reporting requirements, and this is really important because what we put into our ARPA spending plan is that these rates are primarily going to go for wages for direct support professionals. So what that means and the reporting that goes along with that, the intent of the rate increases. And then we'll open it up for Q&A, and we'll also have ongoing technical assistance. So next slide. Briefly, some facts about the American Rescue Plan. It was a law that was signed by President Biden on March 11th, 2021, went into effect on April 1st. And overall, the overall ARPA provides $1.9 trillion to states in federal funding, basically designed to respond to the COVID-19 pandemic and the economic fallout as a result of the pandemic. There's a part of the law called Section 9817, and that's the part that we're really concerned with and that we are activating around. And that gave us all the states with 1915C, home and community-based services waivers, as well as other HCBS waivers, a temporary 10% increase in the federal share of the funding for each claim, and that's called the FMAP. So what it did is it raised the federal share, which freed up the state share to use these monies for specific purposes in the ARPA spending plan. So this temporary increase is effective from April 1st, 2021 through March 31st, 2022. That's when we benefit from the 10% increase. But we have until March 31st, 2024 to spend the funds generated by the increase according to an approved spending plan. Next slide. So a little bit more on Section 9817 of ARPA. These are some of the requirements. Funds must be used to expand, enhance, or strengthen HCBS systems. So it has to, the use of these funds have to address these requirements and can't be used by states for anything else but these purposes. And we have been approved by CMS to begin claiming the FMAP per the ARPA spending plan that we submitted. So we're able to benefit from the FMAP already. And specific in our spending plan that was approved, it provides for a temporary increase in rates. And we've talked about that in the past, but we're gonna dive into that a little bit more. These temporary increase in rates are through March 31st, 2023. So it really is the main use of the funds available to us. The main use is to be able to do the temporary rate increase. And the reason why is we want to make sure we have a viable provider network and that we have services that are available for our participants. And next slide. So in our ARPA spending plan, there are 5 priority areas that our 14 different initiatives fall into. And so these are the 5 priorities: providing supports for participants and families. Number 2 is strengthening provider capacity and our system infrastructure. And this is where the rate increases fall into priority 2. The third priority is workforce development, and you'll hear a lot more about that going forward. Our fourth priority is improving protections in the areas of health, safety, and well-being for participants. And number 5 is strengthening infrastructure and accountability, where we'll be doing an evaluation of our initiatives. So on the top line on the graphic on the left is the ARPA funds that are available to the state, but we will be able to leverage those funds in other ways. So our total investment is in the $30 million range that we are infusing into the system to strengthen, expand HCBS services. So at this point, I'm going to be turning it over to Stephen Pawlowski, who's going to go over the rate information.
Thank you, Mary, and good morning, everyone. As Mary said, I'm Stephen Pawlowski. I'm with the consulting firm Burns & Associates, which is now part of Health Management Associates. And I will be walking through a very brief overview of the rate study that we conducted in 2020, and then how it is we're using ARPA funds to partially implement the results of that study. So moving through the handful of slides that I have, the rate study was conducted in 2020, and that's a requirement of 1915C waiver programs, which is the authority under which Hawaii and most states deliver home and community-based services. And I won't go into a lot of details about how it is we conducted that rate study, but it follows the approach that we took in 2016, which resulted in the fee schedule that's currently in place. And in brief, it includes a review of service requirements to ensure that we are building rates that reflect the expectations that the division has of its service providers. And then we develop rate models based upon information that we gather both directly from providers through a provider survey, as well as a public comment process, and other published data sources that gives us benchmark information regarding things like typical wages for comparable positions within the states, the cost of health insurance in Hawaii, and the like. The result of that rate study were proposals to increase most payment rates. The overwhelming majority of rates were proposed to increase. There were a handful where we proposed no change. Those are primarily rates that are benchmarked to other systems, including those for registered behavioral technicians. And then there were a literal handful of rates, adult foster home rates specifically, where the rate study did recommend a slight reduction, although as we'll talk about here in the next couple of slides, we will not be implementing any reductions at this point in time. We put forward, or I should say the division put forward, a request to fund this rate study. However, given the rather dramatic reduction in revenues in the state due to the drop in tourism resulting from the pandemic, the legislature was unable to fund those recommendations. And so the rates remain as they were when they were first established in 2016. Of course, now the ARPA funds that Mary covered have provided us an opportunity to begin implementing those rates, at least in part. Before I get into the implementation portion of my handful of slides, I will note that if you're interested in a lot more detail about the rate study, the information is posted on the DOH DDD website at the link provided below. I believe there's also a webinar there that walks through the individual rate models for those folks who really want to dive into the ins and outs of how the rates were calculated. Moving on, however, I want to talk about not so much the methodology, but what it is we'll be using the ARPA funds to do. And so, as Mary mentioned, it's a fairly significant infusion of cash. And we're devoting actually about 70 to 75% of that total funding, that's $30+ million, of it 23 or $24 million are going to these rate increases. In particular, what we're looking to do is to increase the rates by 50% of the difference between the current rates, that is the fee schedule that's in place today, what providers are currently being paid, and what it is we recommended in the rate study. The bar chart here on the bottom of the slide provides an example, and this is for personal assistance habilitation or PAB services. You'll see the current rate is $7.46 per 15 minutes. And this is on the other islands outside the Big Island. The rate study proposed a rate of $9.01, so an increase of $1.55. Although the ARPA funds are substantial, they're not substantial enough to fully implement the rate study for any significant period of time. So rather than fully implementing what it is we've proposed, we've recommended it 50% of that difference. So the difference is $1.55. 1/2 of that amount, rounded to the nearest penny, is 78 cents. So that means the rate would increase from $7.46, like it is today, to $8.24. That's 50% of that difference. And we follow the same methodology for every other service for which we've recommended an increase, which means the increases themselves vary. Those services which we've recommended the largest increases for will receive the largest rate increases, and those areas where we've recommended more modest increases will see smaller increases. However, every area where we've recommended an increase will see higher rates as a result of these ARPA funds. And as I mentioned, and importantly, when folks look at the fee schedule, we want to emphasize that we will not be moving forward with any rate reductions at this point in time. That's both to maintain the stability of the system, but also because that's a requirement of ARPA. During the period that these ARPA funds are in place, the state cannot reduce any rates that are in effect as of April the 1st of 2021. So although I mentioned there were some AFH rates where the rate study recommended some small reductions, those reductions will not be moving forward at this point in time. On the next slide, we talk about the period in which these rate increases are going to be effective. So Mary mentioned during her background remarks that the earning period is limited to a 12-month period of time, and it's going to generate a fixed pot of money of about $32 million. And so we cannot use those funds to maintain these higher rates in perpetuity. What we can afford to do with the $23 or $24 million allocated to this initiative is to increase the rates from July 1 of 2021, so retroactive back to that date, through June 30 of 2023. We understand that it would be difficult to pull those rates back. So certainly we're interested in partnering with the policymakers in the state to make those rate increases permanent. However, that will require, at this point in time, additional state dollars. There's conversations at the federal level to perhaps extend some version of this enhanced FMAP through the Build Back Better Act. But of course, we don't know exactly how that legislation will turn out or if it will come to pass. So we cannot bank on it at this point in time. So we're already gearing up for our legislative strategy to talk about potentially extending these rate increases or fully funding the rate study after this ARPA period is over. So that fiscal year beginning July 1 of 2023. The last topic I want to cover here before I turn it over to Jen, and then I'll be rejoining the conversation here in a couple of minutes, is the individual supports budgets. So those supports budgets were established by developing what we call a service mix, the amount of services that we think individuals in a given residential placement with a given level of need will require to be successful. And then we price those out of the fee schedule. So for example, and these numbers are made up, but we might be assuming that folks that live independently and are in level 1 based upon their supports intensity scale results need 10 hours a week per PAB, 10 hours of PAB per week, I should say. And if the rate for that was $10, which it's not, but making the numbers up, that would mean there would be $100 per week or $5,200 per year. We don't want individuals to be disadvantaged or hurt by the rate increase, right? So the supports budgets need to be increased to account for the higher rates. So again, continuing my made up numbers, if that old PAB rate was $10 and was now moving up to $11, we're recalculating the individual supports budgets or ISBs based upon that $11 an hour rate. So the budgets will go up with the intent being that individuals will be able to access the same amount of services that they were able to access prior to those rate increases. These new ISB amounts will be reflected in Inspire beginning January the 1st, 2022. However, I'll reemphasize that this is a housekeeping matter as much as anything else. It's not going to affect the number of any existing authorizations. And furthermore, the intent going forward is not that it's going to facilitate more services. It's just going to ensure that individuals, I should say, can access the same amount of services given the higher rates that their vendors or their providers are going to be paid. So with that, I'm going to transition the presentation over to Jen, and she's going to go through a handful of slides, then I'll be back to talk about the ResHab rate models that we've developed.
Okay, hi everyone. I'm Jennifer La'a with Community Resources Branch. I am going to be talking about the billing information for providers and more specifically how to bill. Okay, next slide. So as has been talked about, there is the billing for most services, and then there's going to be billing for CD and ResHab, which will be talked about later. So again, we're talking about, I'm going to talk a little bit generally speaking of how to read these provider rate sheets, but then talk more specifically about how to bill for, again, most services. So you guys are all really familiar, I know, with these provider rate sheets. They were sent out yesterday. So hopefully all of you have it. I think it would be helpful. It can be complex, these, really understanding how to bill. So it'd be helpful, I think, just to be referencing it through this webinar. I also want to offer that if providers need any sort of technical assistance or help with this after the webinar, I'd be more than happy to do a call or a Zoom with you to walk you through some of these specifics if you still have questions. Okay, so these provider rate sheets, they identify the new rates. What we did was we highlighted all of the updates in yellow. So you'll see that a lot of this rate sheet is yellow because there's a lot of updates. And again, it was sent to you guys yesterday, and you can also find it on our website. Next slide. Okay, maybe self-explanatory, but I just want to highlight the highlight. So in column H, you will see that it says rate end date 6/30/21. So services delivered prior to July 1st of 2021 must be billed at the current rate found in column H. Again, it's labeled rate end date 6/30/2021. So if you delivered, if services were delivered in May of last year and you still have not billed for those services, for example, you would continue to bill for those services at the current rate, or that what is considered our current rate, but also the rate that you'll find in column H. Okay, next slide. For services that are delivered on or after July 1st, you may now bill at the new rate in column I, which is labeled rate start date 7/1/2021. Okay, so that will reflect the new rate that Stephen was talking about, that 50% increase of the rate recommendation. You will find those new rates. If you haven't already started looking through it, you'll see that there's some of them look maybe a little bit the same, others you'll see a significant increase. So that you will find in column I. Again, as a reminder, this is for services delivered on or after July 1st of 2021. Next slide. So the new service authorizations will not be required for providers to retroactively bill at the new rates. So in other words, we do not need, you as providers will not need to have the case managers go back and re-auth services. You will be able to retroactively bill with your current authorizations. This is the case for all services with the exception of CD services. So please note CD services cannot be billed retroactively. There have been no changes to codes and modifiers. Because of that, we don't need new auths. We are going to be using the same codes and the same modifiers. The changes in the rates were done in the back office, so to speak. So again, no authorizations are going to be required for you to go back in and retroactively bill as well as move forward for most of these services. Please note this last bullet, it says for existing authorizations, the new rates will not be reflected in Medicaid Online. So I know a lot of providers go to DMO to check the budget. You are not going to see these new rates reflected in DMO until participants go through and have their next plan year, their next ISP, when all of those things can be now generated through Inspire. This is all done in the back end, so you're not going to see this in DMO. So you just want to make that clear for case managers as well as for providers that, again, these rates right now are not going to be reflected in DMO. Okay, next slide. So what does it mean to have retroactive adjustments? The new rates are going to be live on January 1st of 2022. Please do not go in there and try to make these changes today. They will not be available for you to make any changes until the new year. Providers can then go in after January 1st and amend their previously paid claims to include the rate increase. So claims eligible for an adjustment are only for services delivered again on or after July 1st of 2021, but you can go back to all those services that were delivered and you can adjust claims. They can be submitted electronically or through hard copy. As most of you know, claims must be submitted within 12 months from the date of service. So all of these changes need to be made within 12 months. However, we do want to emphasize that the 10% FMAP increase ends on March 31st, 2022. Mary covered this. And so what that means is that all claims paid before that date will produce additional funding to be invested in the system. So as much as you possibly can, submit your claims prior to March 31st so that they can count towards this additional funding. Okay, thank you. Next slide. Okay, I'm now going to pass it back over to Stephen and I will join a little later. Thank you.
Hello again. I have a couple of slides that we wanted to insert to walk through the new rate reimbursement strategies for ResHab. Overall, the 2020 rate study didn't result in a lot of changes structurally to how services reimbursed. For those of you who've been delivering services for some time, you'll recall that 2016 had some rather substantial changes. The adoption of the SIS, breaking PAB into a number of different services, including CLS, and ADH also including a CLS group component, and then reinstating ResHab, which had not been in effect since 2011 or so. When we built those ResHab rates, we established a single rate regardless of the type of ResHab setting it was. That is to say, we had the same rate for both certified homes, adult foster homes, in other words, and licensed homes, which include DD domiciliary homes, arches, and E-arches. So we have a couple of slides that compare and contrast what is in place today and what is going to be implemented as part of this rate study. So moving through these couple of slides that we have, as Jen mentioned, we will have new codes and modifiers for ResHab, and it only applies to these services because for just about everything else in the rate study or in the covered array of services, we're simply updating the rates. We have a PAB rate today, we'll have a PAB rate tomorrow. We have ADH level 1, ADH level 1. But for ResHab, there are changes being made to the structure. That is to say, we're establishing different rates for certified homes than for licensed homes. So for that reason, we're going to establish new codes and modifiers as those new rates, or as not new services, new rates get phased in. And so one of the other changes that we're making, and you'll see this here in a table, is that we're also eliminating rates that vary based upon the number of beds in the home. So we're just going to have on one side rates for AFHs and on the other side rates for licensed homes. But I think that's illustrated better here in the next couple of slides. So I've already covered that we have two different categories for ResHab: certified homes, which just encompass AFHs, and then licensed homes, which encompass a number of different types of homes, but most specifically DD-DOMs, arches, and E-arches. And so then we have a table that's going to walk through what's changing and what's staying the same. So first, for reference purposes, in that rates document that Jen has already pointed you towards, these certified rates, or I should say the rates for certified homes or AFHs, are on rows 46 through 51. Today, by definition, because AFHs are generally restricted to 2 placements, they fall under the rate for ResHab with 3 or fewer beds. Going forward, when we establish these new codes and modifiers, they'll be labeled ResHab for adult foster homes. They will continue to be differentiated by the level of need for the individual. So there will continue to be 3 categories of need based upon the 7 CIS-based levels that are in place. And as was mentioned, the new codes will be available in Inspire beginning January 1st for use on and after April the 1st of 2022. For DD-DOMs and arches, that is to say the licensed homes, currently they can fall under 3 different rates. Those with 3 or fewer beds, although those are few and far between, there are licensed homes that have 3 or fewer placements, 4-bed homes, and then homes with 5, or in the case of E-arches, more than 5 placements there. So that differentiation, where you have rates that vary based upon the size of the home, is going away. Going forward, there's simply going to be a set of rates for all licensed homes, regardless of the number of individuals who are placed there. As with the AFHs, those rates will continue to be tiered based upon individuals' level of need according to the CIS. So just as is true today, there will be 3 categories of need, or 3 rate tiers based upon the 7 CIS-based levels. And like AFHs, those rates will be available in Inspire in January for use in plan years beginning on and after April the 1st. Now, before I move forward, folks might be curious as why this decision was made. And it's partly due to feedback that we received from providers as part of work we did for the rate study. We had a couple of focus groups, and folks were telling us that they didn't think that the rates ought to be the same for certified and licensed homes. And in fact, that's what you see really commonplace across the country, that AFH or host home model almost always has a different reimbursement structure than a group home type of model. And that's because of what we presume is generally occurring in the staffing of these homes. For AFHs generally, we would expect that that's largely going to rely just upon the house parent, the caregiver who resides in that home. They may choose to hire staff to work intermittently in the home, but generally speaking, there's oftentimes not a whole lot of supplemental staff in an AFH type of model. On the other hand, when we're talking about a licensed setting where you have 3 or 4 or 5 or more individuals residing, it's going to be hard for a single person to manage that number of participants without some additional help. So although we know that there's a lot of models in the state where you have a live-in caregiver in a licensed home, more often than not, there's going to be additional staff supplementing that licensed care, the live-in home manager. And so for that reason, primarily, we thought it made sense to account for that additional expense that occurs on the licensed home side. And so that's why you'll see when you look at the rates that are proposed, they're going up for licensed homes like they are for most services. In the case of AFHs, the rates are largely landing about where they're at today with small reductions or small increases, but it really relates to how it is we're managing or assuming that the staffing is managed within these different residential placements and wanting to ensure that we're fairly compensating providers based upon the costs that they're incurring and recognizing that there's almost certainly going to be additional staffing support in a licensed home relative to the level of additional staffing support, which may or may not occur at all within an AFH. And so I'll wrap up my brief comments here on the next slide, which is just an excerpt from the rate sheet that Jen has already pointed you towards, and which I know folks are already greatly familiar with. So this is just showing you on the left-hand side of the screen the current rates, which will be effectively ending June 30 of 2021. And those are those rates that are varied based upon the size of the home. On the right-hand side of the screen, you'll see that the new rates and codes will be established as of July 1 of 2021. And that is going to be based upon the type of home, that is whether or not it's a certified or licensed home, and continue to be based upon the level of need, but will no longer be based upon the home size. I'll note, and Jen might provide more detail on this, or certainly will be included in guidance that's released, but these rates are still retroactive, so providers will be expected to bill the rate that's appropriate to them. So for the most part, if you're an AFH, there won't be any rate increase to bill for. There are some exceptions. A couple of the rates are going up, so there will be higher rates there, but most of the AFH rates are staying the same. On the license side, the rates will be, again, based upon this new rate study. So you'll just be expected to bill, as with all services, based upon this new rate sheet that's going to be coming out. So hopefully that was clear. The takeaway is that we now have different rates for certified or licensed homes and no longer have rates that vary based upon home size. So we just encourage you to look carefully at this rate sheet to make sure that you're identifying the appropriate rate given the specific setting that you're delivering. I'm going to pass the baton back to Jen for a few more slides, then I'll be back one final time to talk about some of the reporting that's going to be associated with these rate increases.
Okay, so I just wanted to talk a little bit on the case manager side, again, what this means. So for, we talked about how codes and modifiers are not going to change for most services, but again, that's not including ResHab services, because ResHab services are going to have new codes and modifiers. However, we are not going to be rolling that until next year. So while providers can go in and retroactively bill back to July 1st of 2021, they can do so with their current auth. They're not going to need current auths. We've done it so that they can, again, use the current code and modifier and bill at the new rate. However, there are new codes and modifiers because there's two different services, right? Now there's going to be a ResHab licensed home and there's going to be a ResHab AFH. But in order to seamlessly roll these in without having to completely do new re-auths retroactive, which would be a nightmare, we are going to have those codes and modifiers available in Inspire beginning January 1st of 2022. But we are asking case managers not to select those new codes and modifiers for plan years that are prior to April 1. So you're only going to select those new codes and modifiers for ResHab for plan years that begin on or after April 1st, 2021. So this next slide gives a couple of examples. So again, starting in January, Inspire will have codes for ResHab. There will be those two new services, and they're new because one is for AFHs and one is for licensed homes. So if the plan year, if you're going into Inspire, you have an ISP meeting and the plan year starts in January, starts in February, or starts in March, that's that second column, top box. So new plan year that starts in January, February, or March, you're going to continue to use the old ResHab code with the number of beds. So you're going to continue it as you're doing today. If, however, you're going in there and having your ISP 3 months in advance, which is great, and the plan year doesn't start until April, then you're going to then use new ResHab codes that is differentiated by the type of home. So I see that there's a question in there and we can talk about it later, but you know, just to reiterate, ResHab is no longer going to be differentiated by bed number. It's going to be differentiated by type of home. So you're going to have certified or AFH homes, tier 1, tier 2, tier 3, and you're going to have licensed homes or DD-DOM arches, which is going to be tier 1, tier 2, tier 3. It doesn't matter if you have 4 beds. It doesn't matter if you have 1 bed. It's going to be based on the type of home, not the number of beds. Okay. Hope that helps a little. Again, I know this is a lot of information, so please just take some time to absorb it. If you have questions, let us know in the chat, but you can always come back around. Next slide. So I'm going to briefly touch on CD services. Most of you are providers, so this is not as relevant, but just so that everybody knows, as well as for case managers. Next slide. So the rate increases for CD services are not retroactive. I touched on that in the beginning. I said all services except CD will be retroactive. The increased rates begin January 1st of 2022. That means they'll have an increased budget as of January 1st, 2022. CD employers may choose, sorry, something just popped up on my screen, may choose to increase their wage for employees based on the new wage range. And they will be working with Acumen before wages can be increased. Okay, so we want to again reiterate that the individual supports budgets, the rates, they're all going to go in, inspire and increase as of January 1, 2022. Okay, next slide. I'm going to pass it back to Stephen one last time for reporting requirements.
Thanks again. We just have one slide we want to cover here for this particular topic. As Mary indicated, the primary goal for the rate increase is to support the direct support professional workforce, which I know as providers, you all are aware has really done a phenomenal work during the recession, but it's also strained a workforce that was already facing a lot of pressures. And so in short, it really has exacerbated the workforce crisis that predated the COVID-19 pandemic. So it's widely recognized that in Hawaii and across the country, there's a shortage of DSPs, turnover remains an issue. And so we want to ensure that the bulk of these rate increases are used to support the direct support professionals. That's what we committed to in the spending plan that CMS has approved. And we said that we would ensure that that was the case by adopting some reporting requirements. Now, Hawaii is not taking as heavy-handed approach as some states are, which are being really prescriptive about exactly how providers may use these funds. We recognize that providers have put a number of systems in place already. So they're all starting from different beginning points or starting lines. And then what works for one agency might not work for another agency. Employees of one agency might value a pay raise, while another agency, employees of another agency might prefer a richer benefits package, more pay time off or better health insurance. And still employees of a third agency might appreciate more professional development and training opportunities. So we're not telling you exactly how to use the funds, but we are suggesting that the funds are used or primarily intended to be used for DSPs. And so to ensure that that's happening and so that we can report back to CMS, and then also to support advocacy at the state level, which I mentioned earlier in my remarks, to extend or perhaps fully fund the rate study that was conducted last year, we're going to be collecting information about the state of the DSP workforce and how that changes over the next couple of years. That report's not finalized yet. We are working with a small group of providers to test drive it and make sure that it's reasonable, because we do want to ensure that we have a standardized format so that things can be rolled up at the statewide level, because we're certainly not interested in reporting any provider specific information. So we need a standardized form, but we also want it to be simple enough that providers who are very diverse in terms of their structures are able to complete. And so we hope to have that finalized here in the next couple of weeks, and then we'll be sharing it with all of the provider community, as well as the instructions for completion and the deadlines for submittal. In short, it's going to cover topics that I think you could probably predict pretty readily. We have a number of questions in there about the wages paid to direct support professionals, as well as their benefits. And again, with this 2-year continuum, we're hoping to see that there will be investments in the direct support professional, which we can point to when we're suggesting that at the statewide level, funding ought to be appropriated to maintain these rate increases. And it's also going to cover other topics that speak to the health of the workforce. So things like the tenure of staff at your organization, how many have been there just within the past 6 months versus how many there over, say, 2 or 5 years. There'll also be questions about the number of folks who joined and left your organization. Again, the idea here is not to name specific providers, to roll things up across the entire provider community, so we can take a look at the health of the DSP workforce at the state level, and then see the benefits that these rate increases are producing for DSPs. As I mentioned, we'll be in the next couple of weeks rolling out the form itself, as well as some instructions, and likely also be providing a training for folks so that they can answer questions directly as well. So with that, I'm going to pass this over to Mary for parting and closing remarks before I think we've reserved some time for questions and answers.
So in closing, thank you. I know this was a lot of information, and I think we'll spend time on the Q&A. So just in summary, the time period to benefit from the 10% FMAP does end at the end of March. So we need to work together to make sure that we can generate the additional funds that will be reinvested into the system. And my final closing remark is thank you so much. I know that this rate increase has not, we would have liked to just turn on a switch and that would, there wouldn't be any extra kind of steps to go through, but there are limitations to the FMS system with Conduent, and we had to think through so many details to make sure that we are implementing smoothly and accurately. So I think with that, we are turning it over to Q&A. And Abby, are you going to manage the Q&A?
You are correct. So again, thank you everyone for attending our formal part of our presentation. We have reserved the last 10 minutes for Q&A. Let's start things off with Kathy. Kathy asked, what will we need to rebill as corrected claims with corrected claim numbers?
So this is Jen. I think a lot of the different provider billing systems are different in how they do adjusted claims, but so I can try to, if there's something specific, Kathy, that you want to talk with me about after, I can work with you on that. But again, adjusted claims may be submitted electronically or hard copy, and the claim numbers can be the same.
Okay, thank you. Our next question is, what if I have a certified home with 4 clients? How do I handle this?
So the rates themselves are now going to be just based upon the type of the home and the level of need of the individual. So recognize that there are some limited circumstances where there might be more than 2 placements in the certified home, the same rates will apply. So you'll be billing for those 4 participants at the new rates for the certified homes based upon their level of need.
Next question that we have pertains to billing. Do we start January 2022 or do we wait until April 2022?
So you're gonna start to bill in January of 2022. So, but you can go retro again, using the same codes and modifiers back to July 1st of 2021. However, the new codes and modifiers are going to be for plan years that begin April of 2022. So you're going to use old codes and modifiers for plan years. And this will answer some of the questions that are coming up too. So if a plan year begins January, February, or March of 2022, you're going to continue to use old codes and modifiers for the entire plan year. You're not going to do half and half. You're going to do all old codes and modifiers. We're not going to put in the new code and modifier until we start plan years beginning April of 2022.
Thank you, Jen. You are correct. That did take care of a lot of the questions that we have. Next question we have is for case managers. Do case managers have to do a new SPAF for the new ResHab service?
I can answer that. This is Sandy from Case Management. So I think we're talking about two different things. So if you currently have a service and you're already authorized for ResHab, it's only about the rate change. So you will not need a new SPAF. The SPAF is for like a consent to provide the service, but this is regarding the rate changes. So unless they're transitioning from a family home and going to a licensed certified setting, and it will start ResHab services, yes, you will need a SPAF. But for this presentation about the change in rates, it was more for the change during the plan year of April for new services, and the existing ones you're using your current ones, which you already have SPAFs for.
Thank you, Sandy.
Sorry, Abby, there's a question before that, right before that I wanted to answer. It says, for clarification, ResHab is retro from July 1st, 2021 to when? So it's going to be that rate is going to be effective until June 30th of 2023. I think what people are getting confused about, and I don't know if Mary or Stephen want to better explain this, but I think what people are getting confused about is, what do we mean that the FMAP ends in March of 2022? I think people are getting confused about what that means in terms of the rates, but the rates are going to be, these increased rates are effective through June of 2023. Do one of you want to try to answer the March of 2022 date?
Sure. So you did a great job summarizing it already, Jen. The period during which the state's benefiting from that 10% increase in the FMAP is April 1 of 2021 through March 31st of 2022. So all spending through the waiver gets the enhanced match. And then those dollars that are generated by the enhanced match are what we have to spend over, actually, to make it more confusing, a 3-year period. The rate increase we can't afford for 3 years. We can only afford it for 2 years. So the rate increase for all these services will be in effect between July 1 of 21 retroactively through June 30 of 2023. The emphasis on this March 2022 date, though, is just because as much as we can get paid out by that date generates more money through the waiver, and therefore more money that we can reinvest into the system. But the rate increase is for that full 2-year period at this point in time.
Thank you, Stephen and Jen. We have so many more questions coming in. Let us talk about the ISP. If we already had the ISP and plan years start January or February, does the CM have to do anything in Inspire?
No.
Okay, thank you. Going back to some of the dates for ResHab billing, do we start?
Wait, I'm sorry, Abby. I just want to say, no, the answer to that question is no, you don't have to do anything. However, for those participants, when they have their ISP for their plan year, January, February of 2023, that's when they're going to, so next year, this time when they're doing their ISP, they're going to now start to use the new codes and modifiers for ResHab. Sorry, I just wanted to give a full answer.
Thank you, Jen. All right, going back to ResHab billing, we have an attendee that is unclear of some of the dates for ResHab billing. Do we start January 2022 or do we wait until April 2022?
So if this is a provider that's asking this question, I'm not sure, but you can start billing beginning. So although the rates will be effective July 1st of 2021, you cannot start submitting adjusted claims today. Right now it's December. So you cannot go in and adjust claims today. You cannot go in and submit your December billing at the higher rates. You can't touch the higher rates until January. So once January comes next month, 3 weeks, oh my goodness, something like that, it's very soon. In like 3 weeks or so, January 1st of 2022, you can then go back and adjust your old claims for services delivered on or after July 1st of 2021. I'm sorry, you guys, if I sound like I'm repeating myself, but it's a lot, so it's okay. I just want to keep repeating it, so hopefully you can just keep hearing it. So again, you're not going to touch you're not going to adjust any claims until next year. Then you can go back all the way back to July 1st of 2021 for services that were delivered on or after July 1st of 2021. Then in January, when you have no new services that start to get delivered in January and you submit your billing for January, you can again use those new rates.
Awesome. This question has to do with the increase. It says the increase ends on March 31st, 2022, but you're saying if you want the impact to continue over the next couple of years, how can this be measured over time if the rate increase ends on March 31st?
So that's what I tried to address, and Jen tried to address a minute ago, that earning period, the period during which the state's getting the additional 10% ends March 2022. The rate increase will be in effect July 1, 2021 through June 30th of 2023 using the ARPA funds. And there's a conversation after that about potentially extending it, but what we're committed to doing at this point in time is July of 21 through June of 23. And we're apologize for creating the confusion with the March 2022 deadline, but as Mary concluded her remarks with, we really want to demonstrate that working together, we can produce more money that we can reinvest in the system. So although you have 12 months to resubmit these claims from the date of service, the more that we can get processed prior to March 31st, 2022, the more money we're going to be generating that by federal law needs to be reinvested in the system. So that's why we thought it was worthwhile to kind of share some of the inside baseball in terms of the relationship between the state and the federal government, because working together, we can really generate some more funds that we can do to improve services for individuals.
Thank you, Stephen. Continuing off of the increased rates, can it be reasonably expected that the rates will not reduce? It would be difficult to tell an employee that you get a raise for a specific time period and then take back the raise.
So I don't think any guarantees can be made. I mean, the lay of the land today is that these federal dollars only get us to June 30 of 2023. We are optimistic that after that, one of two things could happen. The federal government could extend in some form or fashion this higher FMAP, which would allow these rate increases to continue, or working collectively, we can communicate to the policymakers in the state the importance of keeping these higher rates in effect. And certainly one of the things that we would point to, and part of the reason for our data collection effort, is to say, providers have granted these rate increases or enhanced these benefits based upon these higher rates. If those higher rates go away, the providers might have to pull back on what they've already granted, and that will, as the commenter said, affect morale. But the department by itself doesn't have these funds. So the dollars are going to have to come from somewhere beyond June of 23, either from an additional federal increase like this 10% deal, or through additional appropriated state dollars.
Maybe I could just add a little bit to that. the ARPA funds only took us so far, and we don't have extra funding, but we thought it was worth it to infuse these dollars into the system. You're right, it would be really hard to pull back salaries or wages to direct support professionals and others. So we will work diligently with all stakeholders through the budget process. And that's really the vehicle that we have to, and we've always used to impact any increases to rates. So we'll use that same process. And for us, we can't advocate directly, but what we can do is to educate. But we are hoping that the partnership that we have with providers and stakeholders will, the more people that get educated on the process and what's needed to sustain rates, the better. So we look forward to working with you on that.
All right, we'll take one last question and then we'll go ahead and provide everybody with a follow-up email address that you could go ahead and ask additional questions after today's webinar. The last question that we will take will pertain to quarterly reporting. What period does the quarterly reporting start? July 2021 or January 2022? Since we cannot retro bill until January 2022.
That is to be determined. I'll tell you what we're collectively leaning towards is making the reporting retroactive as well. It's going to depend upon obviously what providers are able to pull from their payroll systems. We're hopeful that we're asking for reasonably straightforward information that will not be onerous, allowing us to go retroactive, because that would allow us to have a firmer baseline baseline information, right? So that when we're evaluating results, we'll see where we've started and then have a better understanding of what additional investments may have been made over time. So subject to change, but ideally, we're going to ask for that reporting to be retroactive as well.
All right, everybody. We do see some of the questions coming in. Some things that we would like to remind you that the rate sheets will be available online by the end of the week at the same website address that we listed in the chat, as well as within the Q&A. The reason being is the reason why the rate sheet isn't loaded up quite yet. We actually have to convert it for accessibility purposes. So if you would like to receive the rate sheet directly, we can go ahead and follow up and provide you with a CRB email address. All right, everybody.
Can I just, sorry, Abby, can I just say a couple of things? So again, all of the providers actually should have gotten their rate sheets. But if for some reason you have not, let us know. And as I mentioned in the beginning, this is really technical. What you also were sent with the rate sheets yesterday was billing instructions. So these slides were actually built based on that like memo or letter or billing instruction sheet. Hopefully now, I'm sure if you tried to read it before, you would have been like, what in the world is happening? But hopefully now, if you go back and you read it, it makes a little bit more sense. That coupled with this slideshow, all the information is in there. When are the effective rates? It's going to be slide 9. There's a slide specifically that says case managers, and it has information for case managers because I see all your guys' questions coming in. So, please feel free to reach out to me if you need to have more TA, if you have specific questions. I'd be happy to, like I said, email, get on a call, whatever you guys need to better understand this. So I just wanted to say that. Thanks.
Thank you all for being here today. We appreciate your attendance in today's webinar presentation. Should you have an additional question for our Community Resources Branches team, please feel free to reach out to us at doh.dddcrb@doh.hawaii.gov. Also, visit our website for the latest news and events from the Developmental Disabilities Division. Our website address is health.hawaii.gov/DDD. Mahalo, everyone, and have a good day.